Hello, everyone, and welcome back. I am your host and moderator for today. I'm Colleen Tewksbury. Many of you I've met before. I'm the Bariatric Program Manager. I'm going to shift things over and introduce our guest for today's discussion. So today we have Julie Parrott with us. She is a clinical nutrition specialist. She's based out of the Hospital University of Pennsylvania. You have likely seen her at different events or in counseling sessions. We are lucky to have her on board and that she brings a wealth of knowledge to our group and that you get to benefit from. She has worked in bariatric surgery, specifically around nutrition interventions within bariatric surgery for 20 years. And she is the lead author for the American Society for Metabolic and Bariatric Surgery's guidelines for micronutrient management after bariatric surgery. So we have a true expert here with us today. Very exciting. And in her free time, when she is not counseling bariatric surgery, patients who have had bariatric surgery or preparing for it, she enjoys biking in good weather and exploring the outdoors. So always good to know everyone's hobbies as well as they come to our group. So welcome, Julie. We're excited to have you here.
Well, thank you. Good to be here.
All right. So I'm going to hand things over to you now and pull up your slides. We're ready to go whenever you are.
Okay, sounds great. So, hi everyone. As Colleen said, I'm Julie. I'm one of the registered dietitians and nutrition specialists for the program. So, this particular support group is titled Supplements, and we're going to focus on vitamins and minerals and the update. So first off, just a very quick overview. Hopefully you've either had the gastric sleeve or the gastric bypass. And one of the changes that takes place in our body when we have these procedures is there is a decreased production of stomach acid. The stomach acid is necessary for our body to be able to use the food that we eat and that we drink and pull these vitamins and minerals to be used in all the different cells in our body. So we'll have a decreased production of this acid, which can mean we'll have a decreased ability to pull these nutrients from our food after bariatric surgery. So it's not necessarily malabsorption, but there may be altered absorption. So with that in mind, why are we asking you to take vitamins? Why would you even need to take vitamins? So hopefully we'll answer that in the next few slides. So first off, I'm sure many of us have felt fatigued, tired. Well, that can be due to any number of different things. But did you know that vitamins, minerals can actually help prevent some of this fatigue? Some other things that vitamins and minerals are important for is to keep our hair, skin, and nails healthy. If someone was to have a vitamin deficiency, we might see something like a curved nail. We might see skin that kind of sloughs or becomes super dry, and or excessive shedding or thinning of the hair. Another couple of things that can happen without appropriate vitamins and minerals is we might have cracking in the corners of our lips, which can create burning and pain. The lip itself, the tongue itself can become very kind of red and almost swollen and also smooth. Whereas the lips, we might see some cracking, some chapping, and repeated chapping of the lips. So some of these vitamins, and these in particular, can be due to some of the B vitamins. So that's as far as any potential side effects, just a few to share with you. Excuse me. So, since none of us want to have those, and none of us wants to experience any of those symptoms, what are some things that we can do to help prevent that from happening? So multivitamins. We recommend specific multivitamins. And what we've done recently is we've updated. So we will have a new LifeGain manual, and the format is going to be just a little different. So as you see at the top of this screen, it says multivitamins with 18 milligrams of iron. Multivitamins that have the least amount of iron, 18 milligrams, is important because it can help decrease constipation from having too much iron. Sleeve gastrectomy, patients who have that procedure usually do well with 18 milligrams of iron. However, if you're a person who's had an iron deficiency in the past, has a current iron deficiency, or you have periods that are very heavy cycles, then we would not want you taking the 18 milligrams. We would want you taking a higher amount of iron, which I'll show next. There are some different brands, as you see listed on the left side. So we have some that are specifically bariatric formulated. And then we have some that you can buy in the stores, which are more commonly known. Some of these names, which we currently have in our Life Gained manual, are Celebrate. It used to be Celebrate MCR 18. It has a name change. It is Celebrate 118. So if you go to get that product, if you've been using that, then please make note of the name change. There's also a few other vitamins that during our update we found and we think that you might find very useful. We have another bariatric formulated vitamin, and then also some of you had been asking about liquid vitamins and the different chewable vitamins. So we've included some that you might find in the stores, such as Alive, and then below that, some of the chewable vitamins that we currently recommend, the Flintstones and the Centrum. What I do want you to know, we have a little bit, again, different formats. So we have the amount that you would need to take to meet all the different vitamin and mineral requirements. We have what form it comes in, whether it's chewable, capsule, liquid, and then also the amount of iron, just so you see there might be a slight variation. Most of these vitamins, a multivitamin itself is not going to provide everything you need. You will also need a calcium. But in addition to the calcium, some of these vitamins don't provide everything, and so you would need to take additional vitamins. For example, in the Alive, the liquid multivitamin, you're going to need to take, in addition to calcium, vitamin D and vitamin B12. And as you go down the list, you can see that there are a couple where you are going to need to take quite a few additional types of vitamins, and they are listed out. So I'm going to move to the next page, which actually is now going to go into the higher level of iron. And these multivitamins are important and recommended for people who have the gastric bypass, as well as patients who've had the sleeve gastrectomy and have heavy periods or have a history of an iron deficiency. The type of iron that's used in some of these vitamins can be a little bit more gentle to the system. So I wouldn't be afraid of a higher level of iron. It's actually something that your body needs and your body will use. So on the far left, again, we've got the different names. We've got some bariatric formulated. We even have a few additional vitamins for you to choose from, different companies. So you could do a cost comparison at home. And then on the far right side down that column, you see that the only thing you need in addition to these particular vitamins is calcium. So this might be good. Down the road, we'll definitely have some handouts or additional information for you to be looking at in print. So moving into the next. What is one of the main vitamins I've mentioned that you might need to take or you do need to take in addition to the multivitamins? Well, it's calcium. And why do we need calcium? Well, we've always heard about calcium being important for bone, and that's true. If we don't get enough calcium, then our bones can weaken. So going from a healthy bone on the left into maybe a condition of osteoporosis, and even severe osteoporosis where there can be increased risk of fractures or even breaking bones. We don't want that to happen, so again, we make recommendations. And the recommendations that we have for you are these different types of calcium. So on the left, we have calcium carbonate, which is something you need to take with food. And on the right, we have calcium citrate, which you can take at any time of day, but regardless, either type, either one of these, you should not take with an iron-containing product. So that typically means we don't want you taking your calcium with a multivitamin. So some of these are going to look very familiar on the far left, the Viactive, the Caltrate, some of the more generic brands. We now have seen that some of the brands that are found in maybe Costco or Sam's, they make a tablet which actually has a higher dose of calcium, which is great. So you might only need 2 of those. And then there's some additional on the right, which actually come in powdered form, or even we found a liquid form for you to try. So that's what we've got for our updated calcium. And just keep in mind that you will need between 1,200 and 1,500 milligrams of calcium per day. Patients who've had the sleeve, you would need the lower amount, 1,200 milligrams, whereas patients who've had a gastric bypass or even a revision, you're going to need a higher amount, 1,500 milligrams or more. So what does that mean? Are you a person who really wants to be so tired that you're having to pull yourself off of your desk? Or would you rather be a person who's energized and feeling great as you're losing weight? This is where we want each and every one of you to be. So I hope that you guys have some questions, and I'm happy to answer and help in any way I can.
Excellent. Thank you, Julie. That was a ton of help. There's a ton of great information, and there's a lot of great discussion going off on the side right now for discussion around post-operative experience and individuals updating each other on progress, which is really exciting to see. So now we're going to shift over to some Q&A items. So I'm actually going to start this off with a general question for you, Julie. Okay. And I think I have a feeling I know what the answer is going to be because I've typed it out to a few people in the chat here of pick up the phone and call a dietitian. But I want to see your reaction or hear your reaction to this. We'll hear often from people that just like the supplements, they just don't sit well for them. Like they just don't like something about one supplement or another. What's your response for those that are just, they've tried out 1 or 2, just didn't like it?
Typically what I tend to recommend, I'm one of those people that tends to get nauseated with vitamins. So I can kind of understand what you're talking about. So typically we'll recommend that you take your multivitamin, since it tends to be the vitamin that has the most potential for some nausea or other side effects, but to take that towards the end of the day, so that if you do experience any GI discomfort or nausea, that it's not going to affect you throughout the whole day. Also, to take it after you've eaten something. It doesn't have to be anything large, but could be a couple of crackers or pretzel. And then some people do fine taking it right before bedtime. So that tends to help alleviate. That's the first thing that we typically recommend. If somebody was to continue and maybe they're using one of the 1 a day, the bariatric formulated, which are very potent, or maybe a person is using, over the counter, but yet they're having to take all of their other vitamins at the same time, we might have you actually separate out the vitamins and take them at different times throughout the day, again, eating something along with it. But the bariatric formulated, this would be a time when we might say, okay, 1 a day may not be the best for you, and let's look for a 2 a day or even 3 times a day.
Yeah, excellent. And Julie, what I'm hearing from you is that this is this can get complex fast depending on somebody's individual needs.
Exactly. You're right.
Yeah. So all of that to say, and there are a few comments around this, please reach out, talk to your dietitian, right? That's what we're here for. You have resources here. So if you have a very individualized need, oh man, pick up the phone, give us a call, send us that My Penn Medicine message. That's what we're here for. Allie, I am so appreciative of your multiple phenomenal questions here. So we're going to take them one at a time here for Julie. Really thankful that you've submitted these. So can the 1,200 milligrams, 1,200 to 1,500 milligrams of calcium, it can't be taken all at once. So how far apart should they be? Can they be?
Well, if we're talking about just calcium itself, typically what we recommend for calcium and the time between other vitamins would be at least 2 hours. So I would pretty much state that that holds true for other vitamins as well. So at least 2 hours apart.
All right, excellent. All right, so the next question from Allie is how often should they be getting blood work then? How often should we be checking these things?
Well, I like the schedule that we currently have, where we do most of the vitamins before surgery, but then also after surgery at 3 months. If there's any deficiencies, then we recommend the treatment, and then we recheck those vitamins. And then they're checked periodically after you have surgery. Once you get to your annual visit, they're checked on an annual basis.
All right, excellent. So let's see here. We have a lot of great questions coming in. Let me filter through some of these. So Jerry's asking, so for Centrum Silver or any of the older adult multivitamins, we'll talk about the whole group, the lower iron, higher B12 standard multivitamins. Do they count towards the daily requirement for multivitamins?
Sure, yes, definitely. So they just may not have enough of B12 in particular and vitamin D, as well as iron. Got to throw that one in there.
Yes. Okay. And then we also have from Shirley here, how important is it to have a separate zinc supplement?
I really would not recommend a separate zinc supplement because with a lot of these vitamins and minerals, if we take too much of one, we have the potential to create a deficiency in another one. And zinc is notorious for being recommended to take to help with colds and other issues. But if you get too much zinc, then you could be creating a copper deficiency. So taking vitamins separately and in larger quantities is typically not the best answer.
Okay, awesome. And so shifting over then, we have some questions around some of the, well, actually, let's stick with Debbie's first. Debbie has a fantastic, straightforward question along these lines with zinc and copper. What's the problem with iron and calcium? With the multivitamin and calcium at the same time as well.
Right. So iron, let's see, when you take iron at the same time as calcium, they both use the same, what I tend to say, they use the same transportation to get to the particular spot in the body. And that particular transportation doesn't allow both to be carried at the same time. Calcium can inhibit iron absorption in just, very small amounts. So that's why we don't have the calcium and the iron put together in one supplement or taken at the same time.
All right, so we have a few questions here as well, Julie, around, and this, I'm cautious to get into FDA approval of these supplements and validating what's in them. And we have a lot of questions about some of these lesser known, quote unquote, plant-based supplements. So for general categories, can you speak at all to the differences between some of these mainstream USP certified supplements versus some of these lesser known, potentially quote unquote plant-based or other types of supplements?
Well, I think plant-based, any type of supplement can be good, but again, there's the potential for some of these plant-based products to actually include some additional herbs and other, I want to say other metals that we're not aware of that can actually become toxic or can really become difficult for the kidney and liver. So we tend to like to have vitamins that have a reputation or have some credibility, even though they're not FDA regulated. Some of the different vitamins who are let's see, at least evaluated by the USP, which is US Pharmacopoeia, can actually provide some of that credibility that you're actually going to be taking a vitamin that's not going to do harm, but actually do benefit.
All right, great. Absolutely. And when in doubt, again, I'm just going to keep on selling this because we're both here, Julie. When in doubt, ask a dietitian. That's what we're here for. All
I meant
right.
to say that.
Yes, yes, yes. Okay, so Valerie is asking, outside of supplements, what about from a food intake standpoint? So she's asking, are there some specific food calories that categories that they can focus on to increase their calcium intake, potentially to offset if you're not taking your calcium as frequently? What are your thoughts?
Yeah, I actually like this, and I think that this is something in our probably in our future updates and the guidelines that we'll really take a close look at. I do think that you can have a combination of food, beverage, and the nutrient to provide your overall needs. It's hard to do that from a group standpoint. It would have to be something that would, again, be done when you meet with your dietitian. Let's say, for example, if you're a person who likes milk and you drink maybe 2 glasses a day, well, right there, you're going to be getting maybe a third or a fourth of what your daily needs are. It just becomes difficult, though, to get all of your calcium needs from food and beverage because, again, your body is changed and you have a much smaller capacity.
All right, great. So this is an overarching comment, actually a few different logistics questions that we've gotten in the comments that I want to address here for the group. One being for the updated vitamin and mineral charts, since they change so often, they are not on our website. So what you can do is just my Penn Medicine message your bariatric team. It's already in a what we call dot phrases, or like a simple, they can send it back to you quickly. Or if you're looking for, if you are a long-term outpatient and you're looking for the Life Gained manual, send us a My Penn Medicine message and we can attach it and send it back to you. So you would have to directly message us for that. It's a quick send back. So please reach out for those. Additionally, if you're looking for specific, is this vitamin or mineral okay for me individually, of a certain prenatal multivitamin or a certain bariatric multivitamin, for your individual needs, please, that's one thing. If it's an individual need, we want to give you an individual answer. Reach out to us, and whether that be through a My Penn Medicine message and say this is for the dietitian, and we'll see it and respond back, or pick up the phone and give us a call and discuss with us individually. So, Julie, shifting back over here, we have a few questions. Let's see. I want to make sure that I'm getting everybody heard here. So, a lot of questions about taking the quote unquote right vitamin and mineral. What are your thoughts with hearing that? I have, right, in my mind, I hear that right vitamin or mineral implies that there's a wrong one. What are your thoughts on there being so many different products, so many different options, and trying to pick the quote unquote right one? Do you have any words of wisdom for our attendees here?
Yeah, I don't know that there's a, I guess I would say, I guess you're right or wrong. I think can be a better and a worse, but I think in order to meet the needs, it is important to, again, work with your dietitian. If you're not going by what the written recommendations are and you're trying to stray from the list, it makes it really difficult for us as dietitians and healthcare practitioners to know exactly what you're taking if it's a brand that we're not aware of or not familiar with. And especially when we're doing labs and we're looking at results, and if we do see some deficiencies, if we're not familiar with what you're taking, or it hasn't been discussed in a visit, it makes it a really difficult, I think, situation. So the right and the wrong. Mm-hmm. I just think that I mean, I think sometimes, I think we have to give, and we do give, general recommendations to really try and make sure that everybody is able to meet the recommended nutrients. And then we also try to take into consideration other factors such as finances and, number of pills and taste and all of that. But again, it's very individual. And so if you're doing something a little different than what the general program recommendations are, then it really is best to talk directly with a registered dietitian. I want to say real quick, though, that I have had patients who've used the MPM, and what's fantastic is you can attach a picture. So I have had patients who've taken a picture of the front with the name, but also the back with the label and the ingredients. That's phenomenal.
Excellent. Okay, so we have two final questions for you here, Julie. And I will say I 100% agree with you here, and I think that all 8 of our dietitians would agree that the right multivitamin or vitamin or mineral is the one that you can take and continue taking over time, whatever that may look like for you. So first question is actually an anonymous one, and I think that this speaks to a lot of your work with the ASMBS in looking at different forms of vitamins and minerals and how recommendations are changing. So we hear about calcium carbonate versus calcium citrate, and previously it was only citrate. Now we're saying you could also potentially do carbonate. What are the differences? Why do they matter, if at all? And are there any implications or considerations that patients should have with this?
Yeah, you guys have had some awesome questions. So as far as how I like to frame it is that just as you guys learn, we also learn, and we're constantly looking at research and doing more research and finding out what's better, for you as patients. And so what can happen in the case of, let's say, calcium citrate versus carbonate is there was some more recent research that's been conducted where they actually looked at the two forms and realized that if a person is taking calcium carbonate with a meal, it actually helps to stimulate acid production in the stomach and the gut, and the person actually is able to absorb about the same amount of calcium as if they were taking calcium citrate, regardless of whether with a meal or not. So calcium carbonate in many cases tends to be less expensive. So the recommendation, since with both of them, just under different conditions, you can get essentially the same amount and the same mineral. It makes sense to modify the recommendations to keep up with the research.
All right. And for those of you joining us right now, it looks like we had some form of a breakdown in communication, or connection. So you may have seen we'll continue shortly and then pop back up. Hopefully we were able to have everything go through there with that communication. So last question for you, Julie, today, the patches.
Oh, yeah.
What are your thoughts about the patches? Tell us more.
Okay, so I have to tell you, I think that the little devices that can use some of these different vitamins are quite innovative. But that aside, the patches themselves, I did go ahead and, before doing this talk, I did do a quick search and looked at, is there any additional research out there that says anything about the patches and even the gummy vitamins? And there is a little bit of research being done with the patches, and unfortunately, so far it's not looking good. But it's all preliminary, so I can't tell you that that in the future we would be making those recommendations. There's a lot of work that has to be done. It's hard to tell how much of the vitamin or mineral would actually be kind of emitted through the topical, through the skin, and how much the body would actually be able to absorb. So it's a pretty involved process in figuring that out. With the gummies, it was a little bit more promising, and not so much for the multivitamins, but maybe some of the individual nutrients. So, we'll definitely keep looking into the research, and, You know, if it comes out, you know, down the line that one or some of those can be used, then we'll definitely be updating our recommendations. But until that time, guess what? Unfortunately, no patches for the vitamins or minerals and no gummies.
Right. Thank you, Julie. This has been a fantastic conversation. I really appreciate you taking time out of your day to join us.